Good afternoon, ladies and gentlemen, the Bailiwick and beyond. Welcome to this coronavirus media briefing. And the main topics today, of course, we'll have questions from the media in due course, the vaccination programme and the extended testing programme. Now, my colleagues, I've got 4 colleagues on the podium today: Deputy Al Brouard, President of Health and Social Care, Dr Brink, Paul Whitfield, and Deputy Salisbury, the Deputy Chief Minister. But my colleagues will deal with the science and delivery of the vaccination programme. Deputy Brouard in particular, he and his committee very helpfully met members of Policy and Resources this week. It was a very informative meeting, and Deputy Brouard will deal, when he speaks in a minute or two, with the rollout of the vaccination programme. Now, in relation to where we are, we're moving forward. It's good news, there's lots of good news, but we must, and I emphasise the word must, continue to be vigilant. We've got a long way to go before this virus is behind us, and we must realise that there is much work that needs to be done. I read somewhere that Guernsey is the rock of freedom, and that's really what we are. We are the rock of freedom because of the way that the virus has been managed over the last 8 or 9 or 10 months. Now, earlier this week, we got down to one positive case. We're now up to 3, which is still, and even if the figure went beyond that, that's still very manageable because we've got a good testing facility, we've got the effective tracking. When people have to self-isolate, they are encouraged to self-isolate, they must self-isolate, and they are supported. We've also, and you may have heard recently, the Isle of Man want to open up the bubble thus again, the travel bubble, etc., and we're very keen to progress that. We can't say we're able to start it tomorrow or next week, but we're grateful for their approach to us, and I'm sure that we will be able to accommodate matters and deal with that in due course. We also have the fact that the UK government announced that from the 2nd of December they're going to have some relaxation of their various restrictions, albeit I'm not quite sure what they will be. But they did say that over the Christmas period they're going to take some detailed relaxation. We're not going to do that in Guernsey, because in Guernsey we can already have functions like we had last week when Dr Brink was kind enough to meet Father Christmas, or the other way around, when we had thousands of people in town. And we want to make sure that between now and when the vaccination programme is fully operational and has fully worked, and that the other jurisdictions around us are also in the same position, that we can continue to enjoy like we enjoyed just a few months ago, the Gay Pride event where 7,000 people or so went, Vale Earth Fair, which was probably the only concert of that type in the British Isles that's been able to operate this year, continues. So we want to make sure that we've got that. We want to make sure that that progress is maintained and continued. We have to accept that that will mean that some families who've not seen off-island family and friend members for some time will have to endure that. Well, we're very sorry. We really are very sorry. But we need to protect the whole of the Bailiwick. Now, I'd like to say something about parking. We know there's pressure on parking in town, particularly with people coming into town to buy their Christmas presents, and we've lost a lot of spaces to make way for the East Arm testing facility. Now, that's meant at the last minute sometimes there's been chopping and changing. We very, very much apologise about that. But the officers who are doing the work that make those arrangements, make those decisions, are doing a myriad of other things. And so, therefore, though that has been an inconvenience, we're sure that the good sense of the people of Guernsey is such that they realise that's a minor inconvenience compared with the task that's being undertaken by the commendable work done by those officials. Now, ultimately, everything is to keep the people of the Bailiwick safe. Ultimately, everything is to make sure that we get these vaccines operational, transmitted, effective as soon as is practical, but that will all take time. The world still faces a very considerable challenge, and I'm not going to use the Winston Churchill phrase at the end of the beginning or beginning of the end, but the sunshine will shine soon. But we need to get there, we need to be protective, we need to make sure that the Bailiwick continues in the way that it has, with the overwhelming stoic good sense of the people of the Bailiwick, and so we can put this horrible virus behind us. I don't generally quote from Conservative politicians, but I heard a phrase yesterday from Boris Johnson when he said, we must keep our foot on the throat of this vicious beast, and that's what we're going to do in this Bailiwick. I now hand over to my able colleague, Deputy Brouard.
Thank you, Peter. The widespread availability of a COVID-19 vaccination is recognised as a significant milestone in our exit from lockdown policy, which was endorsed by the states earlier this year. We are already seeing regular announcements in the media of vaccines reaching the end of clinical trials. Across various states committees, we have been working hard to understand the policy, legislation and operational considerations associated with adopting and rolling out a voluntary community vaccination programme. In making our decisions about what is right for our community, we are guided not just by Dr. Brink and her colleagues, but experts from the UK Department for Health and Social Care, Public Health England, and the Joint Committee on Vaccination and Immunisation, the JVCI. We will receive our allocation of the vaccine through our well-tested UK supply chain. Whilst we still await details from the JVCI regarding which vaccines will be available to us and when, plans are well advanced to ensure that we are able to offer vaccination locally to the same groups that the JVCI have decided to prioritise. Dr. Brink will talk about these groups shortly. The committee met with Policy and Resources earlier this week, and it has been agreed that the vaccine programme will be provided to islanders free of charge. Initially, the vaccine will be administered by our occupational health teams and by primary care colleagues. I would like to take this opportunity to thank our primary care colleagues for working with us at pace to ensure we are ready to deliver this programme as soon as the vaccine becomes available. As we go through the priority orders for vaccinations, more vaccinators will be required, and we will need a community vaccination centre to cope with the number of people we hope to vaccinate each day. We have identified this community vaccination centre, and the Chief Executive will speak more on that. 2020 has required difficult and quick decisions to be made. Ensuring the necessary infrastructure is in place to bring together a community vaccination programme so quickly is further evidence of this. Speaking on behalf of Health and Social Care, I can assure you that we have all the necessary processes in place to be able to consider the designation of a vaccine locally at the earliest opportunity. However, it is really important that the community understands that whilst we might be ready, we will receive the vaccine in accordance with timetables that are outside of our control and set by our UK colleagues. Thank you. Dr. Brink will now take you through more details on the vaccine and updates to traveller testing.
Thank you very much. So just to first of all start off with our numbers, as Deputy Fairbrash said, we've got 3 active cases at the moment. We had no cases over the last 24 hours, so that's really encouraging. I was asked earlier this week about the age breakdown of the 34 cases that we've had since September, and 55% of those cases occurred in people who were over 25 years of age. So that was information that I was asked. I can't remember which of you asked it, but I promised I'd provide that at the press briefing. I'm going to focus on 3 issues today. I'm going to focus on the vaccine programme. I'm going to focus on our expanded testing, particularly on day 13 testing. And the third thing I'm going to focus on is just to look again at our winter preparedness, so important as we move towards the colder weather. So if we then look at our first aspect that I want to discuss, which is the vaccine programme, I think there's certain points that I wanted to raise. The first thing is that vaccines save lives, and this is the most significant breakthrough that we've had since the start of the pandemic, so really encouraging for us. And I think that's important. The other point that I wanted to emphasise is that this vaccine programme will be voluntary. It will not be a compulsory vaccination programme. And I think that's also something very important to emphasise. So there are a number of things that we're going to consider when we roll out a vaccination programme, and these are things that the team have been working on in a huge amount of detail. The first is looking at the vaccine efficacy. So what we know is that the vaccine will protect vulnerable people against coronavirus. So it protects people against getting severe disease associated with a coronavirus infection. As more and more people are immunised, we'll get more information as to whether the vaccine will also prevent the spread of the virus. And I think that's really important as we learn more about the vaccine programme. We've also been looking at the appropriate regulatory framework to deliver the vaccine programme. Again, that's fundamental to a safe programme. We need to look at the infrastructure to procure the vaccine, and we're working within the NHS supply chain, and we'll get a proportionate, based on our population size, we'll get a proportionate allocation of the UK vaccine. So again, we're very grateful to our colleagues in the UK who've worked with us on that. We have been looking at a program to deliver the vaccine. I'm going to discuss that in more detail, just highlighting how we plan to do that. And of course, linked to that are our staff training and protocols. So we're developing the protocols. There is some information that we still need to put in as we get the final details of the vaccines we are to receive. But we've done a lot of basic development of those protocols. Staff training, we've got a cohort of vaccinators that we're training up, and they've had their basic vaccination training. A lot of these are experienced vaccinators already, so they work within our school nursing service, occupational health services, healthcare workers working across health and social care. So we're looking at training protocols specifically related to the COVID vaccine. So that's all part of our preparatory work that we're doing. And of course, the considerations are is which vaccine will we get? So the vaccine type that we get will be dependent on what is allocated by the Joint Committee of Vaccine and Immunisation. So that's JCVI. So they will tell us what type to immunize, what type of vaccine we receive, and the second is who we should immunize. What are the priority groups? Now, this is really important because JCVI is an independent group of experts that advise the UK government. And in Guernsey, we have observer status on the board of JCVI, so it enables us to observe all of those decision-making processes. So that's been really useful for us. But we know it's very likely that we're going to get vaccines that have two different technologies. The first is a vaccine that uses the mRNA technology, and I'm sure you've all heard about that. And that vaccine is now finished its phase 3 trials. So just to remind you, phase 1 trials, you test the vaccine on just a few people to see if it has any immediate side effects. Phase 2, you give it to a larger group of people to see if they develop immune response. And phase 3, you trial it on a larger group of individuals, looking at the response in those individuals. The messenger RNA vaccine will require -70 storage. We have -70 freezers already on Ireland. We prepared for that. We knew this was a possibility. And we will be doing a practice run of getting the vaccine getting a dummy, not the proper vaccine, from the UK, where we'll practice the processes all the way over to Guernsey. So all of that is in hand. The 21 days between the first and second vaccine, so everyone will get 2 doses of the vaccine. And if you get vaccine 1, your second dose has to be vaccine 1 as well. You can't get one dose of one vaccine and your second dose of another vaccine. The second vaccine is using an adenovirus. It's a vector that they use, which is a virus that can't replicate, that has a bit of the coronavirus put into it and endorses and causes an immune response. And that's the second one that will be used. Side effects of both of the vaccines, a bit of a sore arm, headaches, a bit of sort of like muscle ache, but so far the serious side effects, although we don't have all of that information, those are the side effects that are being reported to us. 28 days between the first and second dose, so that then just shows 2 different vaccines, 2 different technologies, which will be delivering simultaneously in the Bailiwick. With regard to vaccine delivery, we've looked at a number of ways in which we can deliver the vaccine. So the main players in the game are going to be primary care, and as Deputy Fairbrash said, we were indebted to our primary care colleagues who have really worked so closely with us on that. And it's been fantastic to have their support in what is the biggest vaccination campaign that has ever been delivered in the Bailiwick. We also will be working with our occupational health services to deliver the vaccination to health and social care staff, and we are also establishing a community vaccination centre, and Paul Whitfield will tell you more about that. That is where we'll immunise large numbers of people. Now, what's critical to us is that we're running this programme in the absence of community transmission of COVID-19. That's really important because the logistics of running a programme when you don't have community transmission of the virus are really, really so much easier than if you're running a programme in the face of a second wave. There are other areas that are going to help us, so the specialist nurses will help us, and indeed secondary care will also help us with specialist groups as well. And I've just showed you this not for you to look at all the detail of that, but to show you that we are going along the priority groups. It is primarily an age-based stratification. Top of the list are residents in care and residential homes, together with staff working with those groups of individuals. We know they are particularly vulnerable. Going down from that, we have our over 80s and our health and care professionals, and then basically going down by age until you reach category 6A and 6B, which is your at-risk groups, and then down to 50 in category 9. With regard to wider population-based immunisation, the data on that isn't available yet, and that will only become apparent when we have more information from these cohorts of individuals that we will be immunising. So what we've also shown you there is the indicative numbers in each group, and again, these numbers may change slightly, but those are the groups that we think will be immunising and the amount that we'll be immunising in each group. So as I said, it's going to be an extremely large programme because each person will get 2 doses of the vaccine. So moving on from the vaccine, I wanted to just highlight part of our testing strategy and the expanded testing strategy. And just to remind you all, our current testing strategy is very extensive within the Bailiwick. So we test symptomatic people, we obviously test contacts of cases, we've got our travel-associated testing, we test hospital admissions, and we also test people pre-surgery. We test pregnant women in the latter part of their pregnancy, and we also have programs to test critical workers and compassionate people travelling for compassionate reasons as well. So we have a large number of groups that we test. But what we've been looking at doing is looking at how we can enhance the safety on the island, and if there's anywhere else we can look at retaining the current favourable situation while we immunise our population. And we've been looking at the recent ECDC guidance and particularly looking at the role of day 13 testing. Now, day 13 testing is for people who have been in self-isolation for 2 weeks, where you test them on day 13 to ensure that they don't have a late infection. So if I can remind you of those graphs that I showed you in the beginning, how we'll get about 94% of people on day 7, but 6% will come positive between day 8 and day 13. So it's to try and detect those groups of individuals. Now, what is important is that if we do test someone on day 13, a traveller on day 13, and they come up as negative, they will be free to go from their quarantine, go from their self-isolation when they receive that negative result. Clearly, if they become positive, we will have to manage them further as a positive case. So I think that's really important, and I think it also provides some assurance, not only to the person, because we've had a lot of people say to us, well, I want to go back to my family, but I want to be sure I'm safe, but it also gives reassurance to the community as well. So this is a real Guernsey Together community project, which we're asking everyone to join us in trying to implement. The final thing I wanted to talk about was our winter preparedness, so our working together to stay well. So I think you might remember a few weeks ago I talked about our Know, Prepare, Protect program, which really is what we need to do to protect ourselves over the winter period. So Know is just keep your eye on up-to-date data, keep your eye on the website, have the knowledge available, know your facts. Prepare, for businesses out there, it's ensuring your business continuity plans are in place. Are you ready to trigger working at home if it's required? But also keep physically active, keep healthy, keep mentally well as well. Look after your mental well-being. So all of that prepares us for a winter. And this is not specifically related to COVID. This can be related to any winter pressures that we might face. And then finally, it's protect. So have your flu vaccine if you're eligible. Have your COVID vaccine if you're eligible and when it's available. Wash your hands. I think you might have all seen our jingle bells times twice, 20 seconds washing your hands as we prepare for the winter. We know that's an effective way of preventing about 1/5 of respiratory tract infections and about 1/4 of winter diarrheal disease, and avoid coming into work if you're unwell. And I think what I'd like to conclude by saying is we are in an extremely favourable situation. Our children are back at school. We've had no school closures. Our children have been back at school since the 8th of June, and they've had no restriction on them. Our pubs are open, our restaurants are open. We're able to gather together to turn on our Christmas lights. all of that means that we're in an extremely favourable position, but we mustn't be complacent. We need to hold on what we've got and heed these messages whilst we move through the winter months. Thank you very much.
Heidi.
Thank you, Peter. So Dr. Brink has told us more about the vaccines and preparation to administer the vaccines when they come. I'm going to talk briefly about safety and what vaccination means for the future. So in terms of safety, available data shows there are no safety concerns over the vaccines that are currently known. However, as I said last time, there's still a lot of work to do before any vaccines can be administered in the Bailiwick. An awful lot of people have to give it the green light. In the UK, we have the Medicines and Healthcare Products Regulatory Authority, the Joint Committee on Vaccines and Immunisation, and the Secretary of State for Health and Social Care for a start. And here we have Dr. Brink and the Medicines Committee, the Committee for Health and Social Care, the Policy and Resources Committee, and the Civil Contingencies Authority. In other words, this is not down to one or two people. No one should be concerned that there won't be proper scrutiny, both from the scientists and the political representatives. Now, when it comes to the future, it's important to be clear that a community vaccination programme here, in and of itself, won't lead to automatic easing of restrictions at the border. Our border regime will not end overnight. Hopefully, as the vaccine programmes in other countries begin to take effect, prevalence rates will go down, and under our current regime, the self-isolation requirements will go down accordingly. It may well be that those who can prove they have been vaccinated are able to travel without restrictions in the future. However, we won't be able to go back to how things were before COVID-19 made an appearance, at least not until we see the effectiveness of the vaccine across populations and we're satisfied that unrestricted travel will not have a serious impact in our islands. But at least knowing that there is a realistic prospect of being able to conduct a vaccination programme in the coming months, we can think about how things may change, which is a relief to all of us. And finally, next week we'll see most of our students coming home for the festive period. Now, as a mum of one of those students, I know very well how many parents are looking forward to having their children back for Christmas, especially as some of us haven't seen them for a long time because of what's happened this year. It's going to be difficult not to hug them as soon as we see them, although I suspect many will be quite happy to avoid the embarrassment of blubbing parents. Students have been sent packs to help them about what the requirements are, and parents can find out more details on what to do when someone is self-isolating on the coronavirus website. I'd just like to say to all those students who are coming back, firstly, fill out the travel tracker before you start your journey, as that will help you get through the ports faster, and to thank you in advance for doing your bit for Guernsey Together. Self-isolating may well be a drag, and hopefully the pilot Dr. Brink was talking about will mean you'll have one less day by yourself. But it will keep those you care about safe. So welcome home. Thank you for what you're doing for the community, and I hope you all have a great time once you're out of isolation.
Thank you very much, Heidi. Paul.
Thank you. As announced by Deputy Brouard, after assessing a number of sites for suitability, we can now confirm that the Community Vaccination Centre will be located at Beausejour, more specifically the Sir John Loveridge Sports Hall. Beausejour staff are now in the process of contacting all event organisers and sports teams affected so that alternative arrangements can be made where necessary. As ever, whilst protecting the public and keeping us safe, we are keen to maintain normal activities and access to recreation. We have a number of potential alternative sports hall facilities, including those in our schools, which are all being considered. Understandably, information from Public Health England is imprecise at the moment, but the extensive planning necessary to roll out the vaccination programme is well underway, and the islands will be ready as soon as the vaccine stocks become available to us. This is the largest scale vaccination programme the islands have ever had to carry out, and continues to be a major logistical challenge to deliver in such a short time frame. The St John Loveridge Sports Hall will be repurposed to provide a clinical setting, medical staff will have to be specifically trained, and a comprehensive vaccine administration service will manage and coordinate the rollout of the vaccination programme for all our population. As mentioned, there is still much to clarify and put in place. As soon as we have the final details how the vaccination programme will be run, how you will be contacted, Any specific requirements of you, those guidelines will be available as soon as they can be confirmed. Appropriate arrangements are also being worked through for Alderney and Sark. Dr. Brink has already described for you the different priority groups who will make up the first cohorts receiving the vaccine. Some of these priority cohorts will be vaccinated, for example, in our care homes or through doctors' surgeries, before the remainder of priority cohorts are vaccinated here at Beausejour. Setting up the Sir John Loveridge Hall will begin on December the 21st, and we will anticipate needing to keep it as a vaccination centre until around mid-May. Although I need to stress again that this could well be subject to change, dependent on the delivery and supply chain of the vaccine itself. As we wait for the arrival of a vaccine, we continue with the restrictions set out for arriving passengers to the Bailiwick to ensure any cases of COVID-19 are managed and contained. Next week, we will begin to see an increase of islanders returning home for Christmas, with a bulk of students returning from December the 4th, although some have chosen to return early. An increased number of travellers will undoubtedly increase the number of positive cases coming through our borders. This is simply mathematics. It is to be expected, and we will manage with the robust regime we have in place. For those returning or with relatives returning, the ports have published some guidelines to help minimise the risk at the ports. This information is available in full on the COVID website. We ask, please, that you check the website for all this information ahead of the date of your loved one is due to arrive. All students have been issued packs of information this week in advance of their travel. It is particularly important to follow hygiene protocols if you have someone isolating in your house or an accommodation. Please make yourself familiar with those guidelines. And it's the basic things like handling washing, handling cutlery and plates that you need to give attention to. The airport will not be allowing family and friends to meet and greet passengers in the terminal building, but you should instead wait in the main car park or arrange a taxi in advance. Depending on the number of passengers on the flight, there may be some delay for passengers coming through, so we ask for your patience and that you check arrival screens and keep in touch with those that you are meeting. Please make sure you arrive in good time to avoid passengers waiting together outside the terminal building and depart for your home or destination as quickly as it's possible to do so. This reduces the risk to all other airport users. Your arriving passengers will be wearing a mask. Please consider doing the same. We understand that it will be very difficult, but unless you are self-isolating with a person arriving, please do not hug or kiss them, as pointed out by Deputy Salisbury. In the spirit of Guernsey Together, we all thank you for your continued efforts and vigilance to keep the Bailiwick safe so that we can all enjoy the festive period. And on this last point, I would just want to remind everyone, wherever possible, hesitate before pressing that online button. Please shop and buy local, support our retail, and keep our money in the economy of our islands. Thank you.
Thank you, Paul. And I endorse that last point. And the members of the press knows out that's what you'll be doing. So perhaps now you've got the opportunity to ask questions. Again, as normal, would you identify yourself when you ask a question so that the people of the Bailiwick know who's asked a good, a bad, or indifferent question? Who'd like to start? Yes, sir. You at the back.
Matthew from Bailiwick Express. This is for Deputy Salisbury and Dr. Brink. Do you need a certain percentage of people to take the vaccine for it to work on a larger level to protect our population?
I think it's around 70%, a lot more, isn't it?
So you've got to differentiate between what we're wanting to achieve from the vaccine in the first instance, which is to protect people against the disease associated with infection with the virus that causes COVID-19. So we're looking at protecting vulnerable people in our community in the first instance. When we immunise that cohort of individuals, information might well come about the transmissibility, about the impact of that virus, impact of that vaccine on transmission, is if the vaccine does impact on transmission and you want to use it to prevent transmission within a community based on the R number of the virus when it isn't mitigated with any non-pharmaceutical interventions, you're looking at about a 70% vaccine coverage. But that's with those caveats that I've put in, if the vaccine in fact does prevent transmission of the virus, so spread of the virus.
And that's really, Nikki was saying, we don't know at this early stage.
Yeah, we don't have the data on that. Where there is data on the prevention of disease or in vulnerable groups.
Thank you. Next question. Yes.
Yeah, Keelan Webster, ITV Channel. Do we have any sort of rough estimate on when the UK will be delivering the information on when vaccines might be available here?
So no, we don't have any exact dates. So we've got several get-ready dates which we can't publicise at the moment, but we're working to those, and we will get further information over the next weeks, over the coming weeks. So we're expecting to get more firmed-up information certainly over the next week. But we will be in line with the UK delivery. So all of the devolved administrations will get vaccine deliveries at the same time.
Any other questions? Oscar.
Hi, Oscar from BBC Guernsey. So you've explained that the vaccines are going to be administered by the health and primary care teams who will be trained up, who are being trained up. How are they feeling about the communication between you and them? Are you hosting sessions with them on vaccination plans, for instance?
Yeah, I mean, I have to say we acknowledge the role of primary care. The other group that I really do need to acknowledge are the health and social care professionals that have come forward to volunteer to be part of the immunisation programme. We really, really have been overwhelmed by the people that have come forward and how willing they have been able to commit to the programme. Yes, we're hosting training sessions. They're doing a combination of online training sessions, but for example, this Sunday afternoon, I'm doing a presentation to primary care, so we're doing it on an ongoing rolling basis. So we're doing that. We also communicate through the Scientific and Technical Advisory Cell. So there are a number of ways which we're communicating out. So we've had a presentation to each of the primary care practice chairs, so we're doing that as well. So a number of things, face-to-face presentations, online training. Some of the online training, as I say, as yet is incomplete because we need the COVID-specific training to come in, and until we know exactly what vaccine we're getting, we can't put in that COVID-specific training.
Juliet from the Guernsey Press. You mentioned about obviously needing to keep the Beausejour Hall until about mid-May. Who are you hoping to have vaccinated by that kind of point?
Up to the end of cohort 9.
Okay.
So that's what we've calculated, that we'll get to the end of cohort 9 by that time. Obviously, there are caveats there. It depends on the vaccine being delivered to us, and so there are a number of caveats there, but that is our anticipation. And what we're doing as we develop this program is we're sharing information with you which might change, but that's what we've done all along, is that we've said this is where we are now, this is what we're planning now. It is subject to change.
It's also, I think, we're planning in whether or not we have restrictions because of any increase of COVID on the island. So we're planning to enable us to do it in a socially distanced way. But if we have any more restrictions than we have now, which are none, that will slow it down.
Yeah, absolutely.
Any other question?
Yeah, what made Beausejour the place that you decided to choose in the end for the community centre?
Well, I think Paul will answer that more fully, but there was an extensive process by officers, and it was decided that this was the best facility for car parking, for health reasons, etc. But I think, Paul, you could add a bit to that.
Yes, I think that's very right. It's about the logistics. If you look at that first phase that Dr. Brink has talked about, 1 to 9, we're talking some 47,000 people. So that is not only administration flows, but flows of people arriving. Some have their own transport, some won't, but also the clinical setting. So it needs to be somewhere with hard surface floors that can be cleaned to the right clinical standards, and that the staff can operate. And a very good point made by Deputy Salisbury is we're really fortunate if we hold the pattern that we're in at the moment, then providing the vaccination regime should be relatively straightforward. If you're doing that under very restricted conditions, it becomes harder. So again, it's a facility that can have flows of people, booze, hard surface floors. Probably the best to accommodate.
Any other questions?
If this pilot is successful, would legislation ever come in to make it mandatory?
Well, I mean, that's a political question, really. I would very much doubt so. I mean, clearly, nobody could mind what's going to happen in the future, any other states, any other circumstance, but I would very much doubt so. We live in a democratic society. People will be encouraged and should fully cooperate with the vaccination process because it's in their best interest and the best interest of the community, but I can't see that it'll be made mandatory.
How long do you think it will take to set up the vaccination centre? You mentioned, was it the 21st of December when that's going to begin?
Yeah, the planning is so that we can equip and set up in 10 days. So I think the point's been well made. The details are still imprecise coming from the UK, but as soon as we know the vaccine is on its way, we can equip the sports hall, and it will take 10 days to operate. We also want to test to make sure it works in practice as well. You will probably see a little bit of early work being done because we're putting in more power sockets. We're making sure that we can get data because we must hold with people having 2 vaccinations. We need to make sure they have the same vaccination, they've got the correct dates. So it's really, really important we capture that data. So yes, about 10 working days.
Yes,
about the day 13 testing. I think your team very kindly provided us with some statistics, I think about 3 or 4 days into and it showed that only about half of travellers were looking at that point to get tested on day 13. Do you know have the levels improved since then, or is that kind of where things have settled? And is there any way to try and encourage more people to get involved with day 13 testing?
So we're hoping by publicising the day 13 people will encourage more people to get involved. There is the advantage that they could come out of self-isolation a day or so earlier, but also that they're doing that to protect their community as well. So we will get more information in a week or two when we see what the impact of publicising this more, making people aware of it. When we phone people, we're asking them and explaining to them why we want to have the day 13 test. So we're hoping to increase those numbers.
Yeah.
Still at around 50% then. Yeah.
Thank you. Yes.
I know that you can only contact people for day 13 to a certain capacity. How do you choose who you contact?
We're contacting everyone. Yeah. So even if someone has chosen not to have a day of arrival test, we will still offer them a day 13 test. The only caveat is as long as we can have the correct contact details.
Yeah. Anybody else? Yes, Oscar.
Will you be recommending those families with returning students reduce their movements around the island for their period of self-isolation? So direct relations, whether or not they're in similar, using similar facilities and following all requirements, etc. But for those direct family members, is your advice to work from home if possible and reduce trips out, etc.?
So not if they're adhering to the requirements of self-isolation. So the requirements of self-isolation are absolutely clear. If a person is self-isolating properly, they should be self-isolating completely separately from their family. There are situations where people will contact me and they'll say, look, really, it's difficult for us to self-isolate separately. In that case, we look at alternative accommodation, or they can all self-isolate together. So I don't think there's a halfway house here. You're either self-isolating separate from your family, or else you need to self-isolate together as a bubble, in which case self-isolation rules apply to all of you.
Can I just emphasise the point that Dr. Brink has made? As a general point, there will be no relaxation of the rules. The rules will be enforced. They're enforced for the safety of the people of the Bailiwick. So there's no halfway house or even three-quarter-way house. All the rules will be enforced, not for any bureaucratic reason, but for pure safety and health reasons. Yes.
Rob Moore from the States Comms team. Island FM weren't able to attend in person today, but did submit a question in writing that they've asked me to put to you. So Island FM's question is, with students set to return in December, are there any plans to restrict access to nightclubs and pubs as an extra precaution?
Well, Dr. Brink will set out the 5 tests, and she counted the 5 tests before you to remind me what they are. But at the moment, no. I mean, at the moment, the virus is being well contained, well processed, etc., etc. So I would have thought, speaking as a non-scientist, a non-doctor, that the chances of that are slim as long as people continue to be vigilant. Dr. Brick.
Yeah. So thank you. There are 5 reasons which are set out in our exit from lockdown framework. So we've stayed true to that, and those are our adaptive triggers which we laid out from the beginning. And those relate to clusters of infections. So if we were seeing clusters of infections which we couldn't control, yes, absolutely, we would think of restrictions. If we were seeing increasing number of cases within our community, if we were seeing increasing hospital admissions, if we were seeing increasing death rates. And the final thing is if we had community non-compliance. So we've got those 5 things that we've used as our adaptive triggers as we moved out of lockdown, but we've also used those as markers for reversion, as reversion triggers as well. So if those 5 factors were not relevant, then we absolutely wouldn't be considering shutting down pubs, bars, restaurants, or any of those over the Christmas period. We've worked to get ourselves in this situation. The students are self-isolating for 14 days. They are being compliant, and we've got the processes in place to manage any positive cases. So I think as long as those 5 issues aren't a concern to us, no, we won't be shutting the bars, pubs, clubs.
Anybody else want to ask anything? Yes.
As far as this pilot goes again, if you're testing on day 13, is there any concern that the virus can present itself later in the day, as later than 14 days, for example?
You don't mean late in the time of the day, you mean after 40? It would be incredibly unlikely. From 14 days onward, very, very unlikely that you'd have a late presentation.
Okay, now carry on with your point and then you come to your
Is there a time frame for the pilot? I mean, how long will it last and what will constitute a success of the pilot?
I think what will constitute a success is if we can look at, get our testing rates up on day 13, we can analyse the results, see how many late cases of infection we're getting, so we can A, implement it properly, and 2, and B, analyse the results on that. So I think those 2 things, I would envisage a pilot would run at least over December and into January.
Okay, you had your hand raised.
And yeah, just a quick supplementary question to my lovely media colleague. Is there capacity to test all arriving passengers on day 13 if they all said yes?
Yes, there is.
Thank you. I don't see anybody else's hand raised. Thank you very much, everybody. People, I say to everybody, be vigilant. If you're vigilant, then you'll be safe. If you're both vigilant and safe, you'll be happy. We'll be back in 2 weeks, and we invite your attendance then. Thank you very much indeed.